Hello, everyone. It's Sherry with the CGH Health Foundation. Welcome to our Growing Healthier program for October. This educational series is sponsored by the CGH Health Foundation, and we try to educate you about important health topics, and at the same time, it gives us a chance to introduce you to some of our providers. In today's program, Dr. Bird is going to be talking with breast health nurse navigator Laura Leal and our oncology nurse navigator Sue Hageman. And we're going to be talking about diagnosing breast cancer and the services that we have to guide a woman through a diagnosis and to help them to address that if they're diagnosed. Let me tell you about next month's program too. Dr. Bird will be hosting Dr. Angel Velasquez, and Dr. Velasquez is a family medicine doctor in our downtown clinic in Sterling, and he also knows an awful lot about treating diabetes. And we're going to be concentrating on the technology surrounding diabetes management these days, everything from apps for the phone to insulin pumps and glucose monitors. So that should be really interesting, and that one will be here on Facebook Live on November 21st at noon. I also want to remind you that the CGH Health Foundation Delicious Designs auction is coming up, and the auction is a virtual one, so you actually go online and bid on our baskets, and the bidding opens at 7 o'clock on October 17th and goes through Tuesday the 22nd. And this year we're doing something a little bit different. We're going to have a preview. We're calling it our Shopatizer event, and so you're invited to come and view the baskets in person live and see exactly what's in them. And it'll be a social event too. We'll have cocktails and appetizers and a prize. I think we're giving away a $200 basket of gift cards. And that's going to be from 4 to 6 p.m. the night before the auction opens. So that's October 16th. Dr. Bird, are you ready to talk to Laura and Sue?
I think I can do that, Sherry.
Okay.
We can make that happen. Hello, everyone. This is Bill Bird. I'm the Chief Medical Officer here at CGH Medical Center. Thanks for taking the time to tune in. I'm going to talk about all things breast cancer and what we do here at CGH to help those women who receive that diagnosis. And I have two of the key people from a nursing standpoint that are part of that process, and I would like to have them. Rebecca, can you get Sue and Laura on screen?
Hello.
Hi, Laura. Hi, Sue.
Hello.
Okay, well, welcome.
Thank you.
Thank you for letting us twist your arms to come on today and talk about breast cancer and the work that you all do. So I thought we would start this by having each of you take a moment just to talk about what your role is here at CGH in regards to taking care of patients with cancer.
All right. Would you like me to go first, Sarah?
Sure.
Sure. All right. Well, my name is Laura, and I work here in the mammography department as a breast nurse navigator. I work alongside some of the best mammogram and breast ultrasound technologists in our area. And we are making it our mission to screen for early detection of breast cancer. I personally work closely with those patients by coordinating any additional imaging that they might need or schedule a breast biopsy that's recommended by our radiologist. And then once all that's done, if the diagnosis of cancer does come back to the patient, I work closely with those patients and coordinate care in getting them education and then getting them over to Sue and the oncology team as well as our surgical team here at the hospital.
Good. Stu, I'll let you go.
Okay, so I'm actually in the oncology clinic. I'm one of two navigators, so Claire and I work together, and we process all the new referrals that come into the department. So we will look at the records, make sure we have all the necessary information and testing as much as we can before they see the doctor. And Claire and I go into the rooms with the new patients. So we see the patients with the doctor for multiple visits. So we're kind of their contact We help educate them about the diagnosis that they have. We do, after they've been that first appointment, we'll help with referrals within our own hospital if they need to go for another test to be done, or labs, or see another provider to help support us. So we arrange that. We help schedule their next appointments. We'll do the education for their diagnosis, and perhaps if they need chemo, we'll do the teaching for them. And we just follow up with them with the doctor. A lot of phone calls, a lot of coordinating care. So that's our main role, is more on the front side of when a person is diagnosed and come into our clinic.
Yeah, very good. So Laura and Sue, maybe let's just kind of talk through, I'll let you, the two of you, talk through. Let's say a woman comes in to do just a routine mammogram, and it comes back as abnormal. So just I want the two of you to do, between the two of you, what you do, what the patient does, and then how you help them out throughout this, from that to, let's say, Sue, at the end of that would be whatever the results come back as, and all the different markers and all those kind of things, and then how you help with the doctors to coordinate that care going forward once you come up with a treatment plan.
Okay.
And I'll leave it to the two of you to talk a little bit here.
Okay, so if a woman comes into our Women's Imaging Center, we do their screening mammogram. Those mammograms are read by our radiologist, and the radiologists give them a scoring system. I personally look through our reports and look for those abnormal, so to say, mammograms that need additional imaging. So I'm looking for those reports, calling these patients up, explaining what the need is in that next step. So we schedule them for what's called a diagnostic mammogram. And if the recommendation of an ultrasound is also needed, we coordinate that as well. Now, they'll come in, do that diagnostic mammogram, and a diagnostic mammogram is just a more in-depth look at the breast tissue, where the radiologist is seeing something that they'd like to look at a little further. And then once that's completed, we bring them back in a few days, and we go over the findings with them if it is something that requires a breast biopsy. And then at that point, we schedule that breast biopsy for them, and then we go ahead and coordinate the care afterwards, explaining things to look for. Well, prior to that, for the biopsy itself, I go over what's to be expected, how long will it take, can they bring somebody, is it something that I have to fast for, will I need someone to drive me home? I explain that whole process from the start to the end, and then I'm there in the biopsy most of the time, holding their hand and letting them know that they're doing a superb job. And then we wait for the pathology report to come back. Okay. And then once that pathology report comes back and the finding shows that there is a malignancy, we sit down with them, we explain their initial diagnosis.
Who's we, by the way, Laura?
The radiologist and myself.
Okay.
We sit down with those patients and we explain the next step in the process, and we coordinate that care. Most often, before the patient leaves, after receiving that additional diagnosis, we have already scheduled a surgical consult visit for that woman before she's left. Okay. And then that's where I hand that patient off to Sue and her team, and they go ahead and take over from there.
Okay, good.
So generally, Laura will let us know, Claire and I know, that there's a new breast cancer diagnosis. Perhaps that patient's going to go to a surgical consultation first. Sometimes they need to go to oncology first. Then we coordinate with that. So let's say they go to a surgery consultation, and perhaps a lumpectomy is going to be done. then they come to oncology after the surgery. So then we take over from there. Usually when the patient comes to our department, they know they have a breast cancer, and we meet the initial time with one of the doctors, and they explain more in depth the pathology report. What, there's different kinds of breast cancer, there's different receptors, negative or positive, and that all directs our treatment. So that's a big conversation that we have with the patient, helping explain their particular diagnosis, treatment options, what to expect, and then we develop a treatment plan. And in that first meeting is usually when we start discussing all that. And we can put a treatment plan in, then we start doing our teaching about chemo, and not everybody gets chemo. So whether it's a radiation center referral or there's another type of treatment, that we just discuss all that, and we start making those referrals happen and scheduling.
Very good. So just to be clear, do all patients go from Laura to the surgeon to then see oncology, Sue, or do some of them bypass the surgeon based upon the type of breast cancer and go just straight to your team?
Every situation's a little different. So between Laura and the surgeon and our department, we all kind of know where people have to go first. Sometimes they have to see the surgeon and oncology kind of simultaneously, and then the surgeon and the oncologist discuss.
Yeah.
Would it be better? Sometimes people have to have chemo before surgery. Sometimes they just need surgery. They might need radiation. Sometimes they, don't need chemotherapy. So without, too much detail about all the different kinds of breast cancer, we know that up front where they need to go next. And so we coordinate that.
Sure. So patients don't have to worry about that.
No.
It's just,
we'll explain it all when they get to us.
Yeah. Right? So Laura kind of helps them to understand this is what's going on. And then you all know where they need to go next, and you get them set up for that.
Right.
Okay, perfect. Yeah, and I guess I also wanted just to kind of talk a little bit about any other wraparound services that are available and we have in play for patients. So I guess I'll let you talk. This is probably more towards Sue, but Laura, feel free to chime in if you want to.
Okay.
Talk a little bit about let's say social work.
Sure.
And or like volunteers that are just part of helping out for patients once they're part of the oncology.
So let's say somebody is actually going to get, chemotherapy, and they're going to be coming to our office every couple weeks for the therapy. We do have a volunteer that's in our department every day, and they do assist with just keeping people comfortable, and we have food and drinks and chairs and the little TV in every chair and warm blankets and just helping people feel comfortable in our department. We also have our social worker that's there every day, and she will visit with each patient as needed. I mean, sometimes people need help with navigating like Social Security benefits or insurance questions or maybe power of attorney papers. She can help if somebody needs help at home, some sort of home aids. She helps with referrals to palliative care, help at home.
Remember right, Sharice also does a lot of work with veterans. Is that right, Sue?
Yep, she's very familiar with the veteran system. So if we have people that need more explanation or services through the VA, she can help facilitate that. She's our go-to when we're not quite sure what to do. For example, we had a patient the other day that had questions about his insurance and trying to find supportive care for him. And she fills in those gaps where nursing sometimes doesn't have all the answers. So yeah, we have quite the team approach, and whenever we are pulling her in different directions, but she'll sit with the patients during chemo and visit with them, talk to the family members. So
Yeah.
She's pretty amazing.
Yeah.
Yeah.
She does a really good job. Also, if you could speak to, we've added another layer of care for our patients. Talk about we now have a chemotherapy pharmacist that's part of the
yes.
process. I'll let you kind of talk about that a little bit, Sue.
Yep. So she's a pharmacist that is dedicated to our department, and behind the scenes, there's a lot of medications that are reviewed and treatment plans that are discussed with the doctors and the nurses, making sure that everybody's prescribed chemotherapy and supportive drugs are on point for them that day. They're reviewing the plans, making sure insurance is covering these drugs. She's going to be helping with educating the patients on their medications as well. So she has an office right up there in our department. So she's got close access to all of us for questions. There's a huddle. They review everybody's treatment plans, everybody that's getting chemo the next day. All that is reviewed with her and the nurses.
Yeah.
So.
And just to be clear too, it's this chemotherapy pharmacist, she goes by CC. She has specialized training in and has specialized certification in chemotherapy administration, because it's such a niche. I don't know whether it's niche or niche, what the proper pronunciation is, but it's very, very specific in terms of what patients need for that kind of service.
Mm-hmm. She's a great addition.
Yeah, for sure. Am I missing something? There's something else you all wanted to share about the work that you do and the care that patients are receiving when they come to CGH for a diagnosis of breast cancer?
Well, in mammography, walk-ins are welcome, actually. We will be starting walk-in hours on Mondays and Wednesdays from 8 to 2:30, and then on Thursdays and Fridays from 7 to 4:30. So that's something that's nice to know that we have out there. An appointment is always great, but walk-ins are welcome.
Yeah. I remember we also have, if whatever the insurance doesn't pick up, we help out in terms of cost for patients on mammograms.
Yes. Our health foundation is wonderful. Actually, they're in the middle of their Delicious Designs virtual silent auction, and they help with the no-cost mammograms, and that's a big deal for us, because just last year alone, 600 women were covered by the program of no out-of-pocket cost to mammograms, and that's awesome.
Yeah, I feel really good about that. Go ahead.
Their donations also help in the oncology clinic with like hats and scarves, and they have these goodie bags for all our new patients. They provide the lunches for our patients.
To help provide Sharice.
Yeah, and Sharice
our
is
social worker.
Mm-hmm.
Yeah, so very much so. Okay, anything else? I know that I feel really, I don't know if the proud is the word, but I feel really good about the work that the two of you do, as well as just like our doctors and the whole team that we have for just cancer in general at CGH. And then that flows into, we also have, we work closely with the folks at NICTIC for radiation as well. For a community hospital, it's easy for me to say, but I so much feel that this is accurate. We have a really, really good cancer department for a community hospital, heck, for any hospital.
Yeah.
So thank you to both of you and for the work that you do, and really grateful for what we can provide for folks who have this,
Absolutely.
who go through the process of getting a diagnosis of cancer, because no one wants it.
Mm-hmm.
No one wants to get that diagnosis. But we do a really good job for folks once they do.
Yeah, and we're here for them from day one, and that's a great thing. That's a part of my job that I really love.
Yeah, and I have to say, in addition to that, just our team, it's not just like our team. Laura and I and Claire talk all the time about new patients coming in, or even if we have, let's say, a patient already in our system and they need an ultrasound or a mammogram quick. And we just call Laura and like she makes things happen. And there's another radiology navigator that helps us get biopsies and coordinates that care. And the nurses in the surgery department and the group out at the radiation center, we all have them on speed dial. And we just, that's part of what Claire and I do too, is just to keep everybody in the loop of what's going on with this patient, because there's always so many people involved in their care, especially up front. That first month or so when they have multiple appointments and we're trying to get test results.
Right.
And, we can call Laura or anybody in the radiology department and, say we need a test tomorrow, and they do what they can and try and get us results. And quickly. So it's a group effort, definitely.
Yes. Yes.
Yeah, good. Well, hey, Laura, Sue, thanks a lot for taking the time to answer some of these questions, and appreciate the work you do. And I have a feeling we'll be twisting your arms again sometime to do this.
Okay.
It's a pleasure. I love doing it.
All right. Thanks again. Appreciate it.
Thank you.
Okay, great. What I want to do now is, just, as usual, just a few updates. First of all, we're going to do an adult drive-through and pediatric flu shot clinic, and dates and locations throughout October. So keep that in mind. Today we're having a blood drive, and you can call that number, or you can walk in and give some blood. So sure appreciate folks' willingness to do that. And yes, I will be talking with Dr. Blasquez in November about new advances in diabetes management. A lot of new interesting things happening from a technology standpoint to help folks who are diabetic to better be able to manage and control their disease. Okay. And then I shout out, there is this Delicious Designs that Sherry talked about that'll be happening here in October pretty soon. And that's online that you can get on and bid on things. So I really encourage you to do that. The Health Foundation provides even way more services than we were talking even about today in terms of for patients who have cancer here at CGH. So please take the time to be involved with that and support it by bidding the Delicious Designs that we have upcoming. Until next month, which will be November, thank you for taking the time to watch this. Please feel free to share it with others, and we'll be talking with you soon. Thanks.